Anna Freud and her major contributions to psychoanalysis. Introduction. Good morning, everyone. Today we'll be focusing on Anna Freud, a central figure in psychoanalysis and a pioneer in child psychoanalysis. Anna Freud was the youngest daughter of Sigmund Freud, but she carved her own distinct path within the field, making significant contributions that have shaped our understanding of child development, defense mechanisms, and the therapeutic process. We will explore her life, her theories, and the impact she has had on psychoanalysis and child psychotherapy. Early life and influences. Anna Freud was born in 1895 in Vienna, Austria. Being the daughter of Sigmund Freud, she grew up immersed in the early developments of psychoanalysis. Although she did not receive formal university education, Anna Freud was deeply influenced by her father's work. She started her career as an educator, teaching children, which provided her with firsthand experience in understanding childhood behavior and development. Her early work with children led to a deep interest in psychoanalysis, and eventually, Anna became a psychoanalyst herself. Notably, she was the first to apply psychoanalytic techniques specifically to children, marking the beginning of her lifelong focus on child analysis. This was her pioneering work in child psychoanalysis. Unlike her father, who focused primarily on adult patients, Anna emphasized the unique needs of children in the therapeutic setting. She believed that children should not simply be treated as miniature adults in therapy, but instead their developmental stage and relationship with caregivers should be considered. Anna Freud's developmental lines theory describes the process by which children gradually move from dependency on adults toward independence. These developmental lines cover areas such as eating, bowel control, and learning, illustrating the complex trajectory of growth and the challenges children face in moving from one phase to another. Another major contribution from Anna Freud is her expansion of her father's theory of defense mechanisms. While Sigmund Freud first introduced the idea that individuals use defense mechanisms to protect themselves from anxiety and unacceptable impulses, Anna Freud offered a more systematic description of these mechanisms in her book, The Ego and the Mechanisms of Defense, 1936. She categorized and elaborated on various defense mechanisms, including repression, denial, projection, and rationalization. Her work provided a clearer understanding of how these mechanisms function in everyday life, especially in children and adolescents. By analyzing these defenses, therapists could better understand a patient's behavior and internal conflicts. Anna Freud's work in this area also led to a greater understanding of the role of the ego in managing conflicts between the ideid, ego, and superego, building on her father's structural model of the mind. The role of observation and direct work with children. Anna Freud was also notable for advocating direct observation of children as part of psychoanalytic practice. She emphasized the importance of the external environment, family dynamics, and the child's lived experience in their development, contrasting with the more classical focus on unconscious drives alone. Her work at the Hampstead Child Therapy Clinic, which she co-founded in 1947 in London, exemplified her dedication to child psychoanalysis. The clinic became a major center for the study of child development, offering training programs and conducting pioneering research in the field. The Hampstead Index was one of the first tools designed to track and document a child's developmental progress over time. Psychoanalytic techniques for children. Anna Freud adapted the psychoanalytic technique for use with children, as the traditional method of free association, commonly used with adults, was not suitable for younger patients. Instead, she used play as a way for children to express their emotions and inner worlds. This technique allowed children to communicate symbolically through play, which could be analyzed to uncover unconscious conflicts. In addition, Anna Freud believed that child analysts should play an active role in helping children deal with their real-world problems, rather than remaining a neutral observer. She understood the importance of the therapist's role in providing guidance and structure, particularly for children who lacked strong adult figures in their lives. The Anna Freud tradition in modern psychoanalysis. Anna Freud's influence extends far beyond her lifetime. Her theoretical and clinical innovations continue to impact psychoanalytic practice today, particularly in the areas of child therapy, developmental psychology, and educational psychology. Her emphasis on the ego, defense mechanisms, and child development still provides a framework for understanding psychological growth and pathology. Her work laid the foundation for later advancements in attachment theory, particularly John Bowlby's work on attachment and separation, which also focused on the relationship between children and their caregivers. Conclusion: Anna Freud's contributions to psychoanalysis, particularly in the realm of child development, have left a lasting impact on the field. Her work broadened the scope of psychoanalysis to include children, emphasized the importance of the ego and defense mechanisms, and demonstrated the value of direct observation and an intervention in therapy.